introduction, my name is Robert Espinoza. I'm the Senior Director for Public Policy and Communications here at SAGE, and I oversee our National Advocacy Program, which I'll talk about a little bit more in detail in a few minutes. But I first want to offer just a series of thank yous and welcomes to the group before we start the program. I want to start with a big thank you to Pfizer, who has been a great partner with us on both this topic and also a series of sessions that we've had over the last few months that have really looked at how do we build more educational resources for LGBT older people. We had a session, I think 2 months ago, that looked at how do we develop cities that are more age-friendly, and then a session on what are the opportunities within health reform to make sure it's more inclusive of LGBT older people. And our goal is to develop all of these resources and package them online, and then distribute them around the country so that more people have access to them. Pfizer has also produced a great resource called Get Old. It's on getold.com, so if you have the opportunity to visit that, there's a whole range of resources related to aging. Just a quick overview of the program. I want to say we'll be watching an excerpt of The Grain of AIDS. It's a multimedia documentary. It's specifically one that combines portraits and oral histories of both long-term survivors and older adults who contracted HIV in later life with HIV/AIDS information. And it's really meant to increase awareness, sensitivity, and collaboration among caregiving professionals. Katja will be talking in more detail about the documentary after the viewing. This is a really important issue for us as SAGE. It's an important issue that has affected a lot of LGBT older people and continues to affect LGBT people around the country. For those of us who lived through the epidemic and for those of us who are well read in history, we know that it's an epidemic that has historically always affected lesbian, gay, bisexual, and transgender people disproportionately. And it's especially affected those who are people of color, transgender people, men who have sex with men. And we're seeing a lot of conversation about what it means to age with this epidemic. Many of us have lost friends and partners to the epidemic over the years, so it's a conversation that's really personal to a lot of us. And for those who have studied the history, we know that it also galvanized the LGBT movement, and a number of organizations both emerged and strengthened in the early years of the epidemic. When we look at the demographics and the statistics around HIV and aging, we see a few pieces that really shine out. One is that we see that within a few years, 1 in 2 people with HIV in the US will be age 50 and older. This is why this issue is becoming more prominent. We see that infections are actually on the rise among older people, age 50 and older, and that many older people are often dually diagnosed with both HIV and AIDS, which has a whole range of implications about how we prevent, how we treat, and how we diagnose HIV and AIDS. We also see that many people often lack the community and support system within the HIV community, within the LGBT community, or often within the aging sector. And for SAGE, that's meant that we've done 3 things primarily to address HIV and aging. First, we offer support groups and referrals through our direct services, not just here at the SAGE Center, but through our affiliate network. We have an affiliate network of about 24 affiliates around the country, including one in DC. It's also been a focus of our federal policy advocacy. We often focused on federal agencies that offer funding to these kinds of issues, and ask that we look at more funding to improve the number of prevention programs and treatment programs for older adults with HIV, but also to expand the research and the literature. How do we better collect data on this issue of HIV and aging? And then finally, SAGE runs the National Resource Center on LGBT Aging, which is the country's first and only technical assistance center on LGBT older adults. And as part of that, we have a module specifically on HIV and aging that we use to train aging providers around the country on the specific issues that are affecting this population. We also have a web portal that's generously funded by the MAC/AIDS Fund on lgbtagingcenter.org, where you can access a whole range of resources, including the excerpt that we're about to see today. To my left is Katja Heinemann. She is a project co-director and visual journalist who regularly produces portraiture, photo essays, and multimedia stories that incorporate photography, audio, and video for editorial, commercial, and institutional distribution in the U.S. Her clients have included Time Magazine, People, Parade, U.S. News and World Report, HBO, and much more. Katja's new media documentaries on HIV in the U.S. include On Borrowed Time, which is about the lives of children and teenagers, and The Grain of AIDS on the aging of the epidemic. They help illustrate how a personal body of work can grow from an editorial concept into an advocacy and educational tool. To her left is Carmine Novembre, who is a public health professional with a career spanning nearly 2 decades. In his current role as Director of External Medical Affairs at Pfizer, Carmine manages the Medical and Academic Partnerships Program, which provides fellowships and creates authentic public-private partnerships in key areas of global health. He also leads a multi-year partnership with the Centers for Disease Control and Prevention to analyze the impact of smoke-free policies on the hospitality industry in 9 U.S. states. Finally, Christopher Davis has a career in nonprofit finance. He is also a published author. His novels have been translated into more than 10 languages and include books such as Valley of the Shadow in Philadelphia. He was also recently featured in a New York Times story about HIV. I want to start with you since you the brainchild of this documentary. Can you tell us how you became involved in this documentary and how it came together?
Yeah, so I'm a journalist, and I was starting to work on issues on HIV/AIDS in this country kind of late in the stage of the epidemic, and it wasn't until 2000, and so long, a few years after protease inhibitors came about. And my interest was to show people that even though media attention at that point had moved on, and all of a sudden AIDS was perceived as being elsewhere, being in other countries, to try to use photography and personal storytelling to get media attention back to the fact that the epidemic in this country actually was not over. So first I did that with a story on children. That was a 5-year project. And then just as I was wrapping that up, the RORA study by Akria here in New York was published. And for the first time, the numbers that the demographics are really quickly hitting older adults in higher and higher numbers was published. So I went back to Time magazine in this case and said, can we do something on this for the 25th anniversary of the epidemic? And they went for that. So I've been working on it. I really started interviewing and photographing in 2006.
How have audiences reacted to the documentary?
I think generally across the board people are surprised. And generally people, and that was the whole point behind doing this, and really sort of putting a face to the aging of the epidemic approach, that this is not how we visualize AIDS, this is not how we visualize HIV. I think most people still think of it as young people's disease, and that's the target group for prevention mostly, and also what's covered in the media.
Carmine, I want to shift to you for a little bit. Can you describe what Pfizer's interest is in this issue of HIV?
So Pfizer's been involved in this space for quite some time. As you see on your chair's Get Old campaign is one of the things we've been launching to encourage healthy aging and active and healthy aging. Medication being one part of that, but a small part of that. Prevention is a key part of that. Pfizer has been involved with drug discovery since the onset of AIDS. We recently, relatively recently, 2009, broke up our HIV/AIDS division to merge with GlaxoSmithKline to actually increase, hopefully, our research and development in that space. So it's another separate company called ViiV, and actually they work on HIV/AIDS drugs.
What are your thoughts on where science and medicine can best support a demographic of older people with HIV?
That's a good question. I think, medication's obviously an important part. I think, we're making tremendous gains in research and development, going from a small molecule to what's called large molecule medication, which is injectables mostly. And we're making tremendous strides, I think, in that space. Is there more to do? Yes. But I think with technology, it actually makes it easier. It increases our chance of success. We have so many drugs that are molecules that are sitting on the shelf that haven't been used. But through this new computer screening and new technology, we can actually go through those compounds and see what can be used. And then, obviously, eventually work with drugs more.
I wanted to shift to Christopher for a bit. What goes through your mind as you watch this documentary? How does it speak to you?
As I looked at that, I thought about how incredibly lucky I am. I was diagnosed in 1986, and I'd certainly been positive for years before then. I had PCP twice in the early 90s, and yet here I am, productive in my office at 6:30 in the morning, working hard and thriving. I never thought that would happen. I never thought that movie made me think about growing old. I never thought I would grow old as a man. I just had no conception that I'd ever be here. And it's kind of astonishing.
As someone who's lived through a few decades, how do you feel like our society has evolved, and where do you feel like there's still misconceptions?
How do I think our society has communities of color, their HIV infection rates are growing. And that has to have something to do with what's going on in the communities. And I lived in Harlem now since 1995, and I'm surrounded by it. So there's a long way to go, particularly in communities that are really being adversely affected from it.
Has this topic come up in your writing? Is this an area of interest?
I wrote a novel called Valley of the Shadow, which is one of the first novels about AIDS, published in 1988. I knew I was positive when I wrote it, and in the book Everyone Dies, and I fully didn't expect it to die. And then I wrote the novelization for the movie Philadelphia, which I wish I hadn't, which everyone knows. And then I said after that I would never write about HIV again, ever, until there was a cure. Well, the cure is an effective cure is generations off. And so I'm again writing under my own name, which I haven't done since 1994. And my new novel will be about HIV. Basically, it's based in Harlem. I may have to leave Harlem. We'll see.
For me, I'm also HIV positive. I've been for 15 years. And for me, I thought, when I first got infected, that it was a death sentence. I thought, well, I have 10 years to live. Okay, that'll be a good 10 years. Well, 15 years later, I'm very content to say that I'm an aging HIV positive person who has a productive job, shows up for work every morning, and this is my first coming out as a Pfizer employee who's HIV positive, but I thought it was appropriate for this group.
What are some of the hopes you have for this documentary?
Well, I think the biggest one is the personal storytelling, which is one-on-one, whoever your audience is. I think it really helps, rather than thinking about statistics, to hear it from someone like Robert, to see how he goes through the different health crises and how that has affected his life. So I think that really adds to the understanding of any audience. And one of our target audiences, as you mentioned earlier, are healthcare professionals. And so that is, we're still trying to find the right partners and figure out what kind of module that would be, but whether there'll be a short film at some point that really shows more like a film that goes to festivals, or if directing people to the website, having more targeted training materials. It's still all in progress. This is not a finished work. It's definitely under production still.
As you were filming the documentary, were there any stories that surprised you? Anything that stands out?
I think, well, there's two answers to that. One, I think that's still, both for me and when we screen it, one of the most surprising or even shocking is one that wasn't included here, and that's a woman named Sue, and she talks about when she was first diagnosed, how one of the nurses, when she was taking a TB test, said to her, "What, you're still having sex at your age? That's disgusting." And literally in that kind of intonation, this is how she tells the story, and that generally people's jaws struck to the floor. And that was also one of the examples that made me think of my project partner also, that we really need to reach out and get this out to nurses training programs and things like that. It's that is not an okay way to talk to your patients.
What could be the focus of future, either documentaries or news stories and so on?
Well, for me, since I'm so invested in the aging part of it right now, for me that is taking it globally and really talking about that this is happening obviously first and foremost in the US because we've just had the drugs here for longer, but then increasingly also around the world. And actually the images that you're seeing behind us here, those were from a project we did in collaboration with the Korea at the International AIDS Conference in July of last year. And so we went there specifically to try to get people to interview and portray who are from all over the world. And the numbers are that I think in sub-Saharan Africa we now have 3 million people over the age of 50 with HIV. And that again is not the normal narrative. And I think people like short-term solutions. And so this here, pop a pill and let's be done and let's not talk about this ever again. That's what we're trying to do with this documentary. It's no, let's talk about this. And what are you going to do? Are you going to treat these people for the next 50 years? Are you going to dedicate the resources to that? And the comorbidities they're going to develop, et cetera, et cetera. So that's...
The stigma is still there, I think, with HIV, and I think that's something I'd like to see eventually gone, but it still is, Here I am, a Pfizer employee. I'm very proud to be a part of Open, which is our out Pfizer employee network. Huge gay presence in our company and very much supported by our executive leadership team. But I'm still afraid to come out about my HIV status. So there's still a stigma attached with that I'd like to eventually see that.
there's something dramatically wrong with the funding paradigm. It's not working. If in minority communities, communities of color, if infection rates are accelerating, all these millions of dollars we're spending are not being allocated right. I don't know what the right answer is, but there needs to be a lot of data analysis to do that.
Well, tell me about your reaction to the New York Times story. You interviewed with the
That
stories.
really, okay, there was an article in the New York Times, and this man came to my office, and I have a great office, and I told him that I'm thriving with HIV. I've been with my husband for 17 years. I'm doing well. He focused on a little 2-year part of my life when it kind of fell apart after my last partner died and I had PCP and all that. And that's all the New York Times wrote about. And that was really moving. And when Philadelphia came out, I had a similar experience with a newspaper in Philadelphia, as a matter of fact. And I didn't do any press for many, many years.
Carmine, I want to ask you a bit about your industry and how its response to HIV and AIDS has changed over the years. How has it changed over the years as we think about the growing demographic, as we talk about the statistics around people of color? What's different now that we'd like to hear about?
So like I mentioned previously, I think it just has to do with the fact that we've combined resources with GlaxoSmithKline to actually address the need, thinking that, you know what, we were all working at it as individual companies, and this was an opportunity to work at it as 2 companies. So that takes care of several drugs. I think it has a total of 12 drugs in its portfolio, and it has 4 currently going through clinical trials. But the nice thing about that too is anything in our research and development arm that's actually discovered in our labs can actually feed into that company. So you have 2 separate labs. We have labs all over the world working on different compounds. Once they detect something that's actually potentially treatable, usable for HIV, they then feed it into this company and then they build on it for clinical trials. So it's a network of people working together to try and solve the problem.
And what would you like to see forward thinking 10 years from now in terms of what is different about how we address HIV?
I think that basically comes back to the stigma issue. And for me, working in the media, and I mean also outside of the media by trying to do advocacy with it, but it's just more storytelling. There's been an amazing amount of work that's come out over the last year in terms of documentaries, whether they're historical or newer ones about the state of the epidemic in the South, among communities of color, et cetera, also about LGBT aging. So I think that is really one step forward to combat stigma. So I think that's wonderful. And to talk back about the media, obviously it can be iffy. And we're hoping to address that on our website and with our own project by really going pretty broad and having a large number of interviews so they all balance each other out in the end. And it's not just doom and gloom.
Getting support or distribution for the subject of HIV, is it an area that you find there's struggle with, or do you feel like it's something that more people are embracing?
Within the mainstream media, it's still a struggle, and it's really hard to place these stories. And every year for World AIDS Day, if there's a big anniversary, yeah, sure. Let's have something that's ready now. Like nobody really does even the advanced thinking that much. I mean, it's great to see a story in the New York Times that's substantial and that really required some planning. But I think overall, it's still an uphill battle to get these stories placed because people do want to think that we have this solved and it's under control, and it's still hitting at the same topics that people prefer not to talk about in society.
I want to ask one last question of the panelists, which is, what would you want the people in the room to know about your stance on this issue, what still needs to be addressed, that would make it easier for people to age with HIV and AIDS? What should people in the room know about that?
It is more difficult. I mean, it's physically more difficult. I mean, I have some physical problems, but you can't, I don't know, it can't dominate your life. You get up, you go to work, you do what you do. I mean, I have seen most of these. And the world needs to realize that it is possible to age and be productive and to contribute to society and have HIV. I mean, it's a disease that we can live with. And we can be productive when we have it, and I'm sure many people in this room are.
That's the key, actually. We can age with it. You know, like that first person in your film where he was actually taking more medications for his other diseases as opposed to as HIV, I think says it all. I think, you know, it's become a chronic illness, a manageable illness. It's no longer a death sentence like it used to be. And I think as science continues to grow and the knowledge continues to increase, I just think you'll see the lifespans continue to increase. I was just recently down in Florida where a dear friend of mine passed away, and he had a couple of T cells, but it wasn't AIDS that killed him, it was cancer, you know, and he had had it for 30 years. So it's actually interesting, the comorbidity and actually the other diseases that are actually being the cause of the fatality.
It's like it's stigma, but not only for HIV, but also for aging and just ageism in general, that prevents people from having honest conversations, whether that's amongst each other, whether it's about dating and safe sex, or if it's with your care providers. And again, having exchanges like have a nurse saying something incredibly offensive to you is completely unnecessary. And I think then, again, that's where media and outreach can really make a difference.
Thank you. I actually want to open up the room for questions of our panelists.
3 years ago, I was in a nursing home. I had fell at 69th and fractured 8 fingers. The doctor comes in and said that we're going to test you for HIV because New York City Department of Health now requires it for people over 63. I said, fine, no problem. I am HIV negative, thank God. Number one, how long is that vaccine viable? In other words, when would someone like me get another shot?
If you're having sex, you need to practice safe sex. And prevention, even in our age, prevention is important. As you were saying, people our age are becoming newly infected. So, one, practice safer sex. Two, if you're having sex at all, get tested every 6 months. Just always.
Unfortunately, we don't have a vaccine yet for HIV, but there are other vaccines that you should be taking, you know, to prevent yourself. For example, this recent meningitis outbreak, my physician was like right away, you know, you need a meningitis vaccine. I said, not sexually active. He said, it doesn't matter. You know, you need to. So I think that's an important thing to keep in mind. That you need to also take care of the other issues too, the other, especially preventable diseases through vaccines.
My name is Peter Bailey. I have a question for the only woman on the panel. You spoke of AIDS as it affects communities of color, particularly in southern states. My question would there be any particular reason why you didn't exactly say how people of color were being affected by AIDS, but were there how, and is there a particular regional factor involved in whatever your answer is?
I honestly don't have data on that handy or anything because it's not something that we covered specifically for this, but like when I was referring to new movies that are coming out, like one is called, literally I think it's called Deep South, which treats that specifically. And there is another one in production that is called Public Health Private Pain, and I don't think that is out yet, but that's in production. But there's fantastic organizations all throughout the South, especially some on women that are clustered in South Carolina and North Carolina. They're doing fantastic work, and maybe we can put like a little resource together on the website afterwards or something where they will have more specific numbers and things like that.
We actually have from the AIDS Community Research Initiative of America, Dan Teets, who can answer this question.
So in the South, I think there's essentially a couple of reasons, not least of which is poorly resourced. So lousy healthcare, lousy insurance coverage, the cheapest Medicaid programs in the country. Sadly, most won't expand their Medicaid programs under the Affordable Care Act, so they'll remain that way. So that's a real problem. So access to care and treatment and prevention services is a problem. With regard to young African-American men who have sex with men, so gay and bisexual men, they actually, in most research, don't have unsafe sex at any higher rates than anybody else does. And in fact, there's some research that suggests they have it at lower rates. But because the HIV is so endemic, how shall I say, a little slip up in sex in that community is way different than having it slip up in sex, say if you're 65 and a white woman living in Eastern Queens. Just the level of risk from the same conduct is much greater just because there's that much more HIV floating around that community that goes untreated. So early diagnosis and active engagement in treatment, as we now know, can reduce up to 96% the amount of virus, the likelihood of new infections. So those are just a couple of things with regard to that.
Could it be due to the fact that it is populations of color in the South?
The two things are absolutely related. There's more undiagnosed, untreated HIV among poor populations, and to the degree that African Americans are poorer than others in the South and have less access to care and treatment, then there's that much more untreated HIV.
As I was sitting here, I was thinking to myself, where is the change in the approach to illness, disease, health in general in our society? And what are the roadblocks to having more of a systems and an ecological approach to these subjects, especially when it comes to a disease like HIV or any disease that sometimes, though not always, is transmitted sexually. In terms of what this gentleman was talking about, he was talking about the tipping point, which we see with other illnesses and disease, like, I forgot the acronym, but, the disease that they're now vaccinating young girls and increasingly young boys for, because they found that that disease was endemic in communities and they had to change the tipping point. But I guess I'm wondering, how does the panel see the approach to the questions I'm raising changing in the next year?
There are still many of us working on parallel channels. So if you think of science and you think of Pfizer, you think of other pharmaceutical companies, a lot of us are working on the same thing, and I think there are synergies that could be realized through all of the companies working together. So I think that's one roadblock. Exactly how you deal with that and address that, I'm not sure, because it's a complex system. The nice thing about it, though, is we're relying more and more on academics. So people in academic institutions are being more of the bench scientists than we used to have, which is actually working in our benefit because they collaborate across lines. So if we can get more of the bench research into the academic medical centers, and then when their discoveries are ready to be developed into market, et cetera, then we can take it from there. So I think that's a roadblock that's in the process of being addressed.
In the panel up there talking about people of color, you insult me. I'm a black person, I'm very proud of it. And we're trying to tell our young people to be proud of being black. Now, Pfizer is supposed to be a scientific company. I used to work for Pfizer. And Pfizer is a profit-making organization. And no one on this panel here talked about the fact that in the black community, our numbers are going up and other numbers are going down. And what pisses me off so much about this thing is we're talking about people of color. And you're supposed to be a scientific organization. That means that there are other people who are not of color. And anybody who's not of color is invisible. And as scientists, you should be able to know that. And I'm also remember the Tuskegee Project. And it wasn't until just recently that the government really acknowledged the fact that they were prolonging that amongst the black community. And right now we see our numbers going up in the black community. And I'd like to know what you think about that. What is your response?
I apologize if I said anything to offend you. I definitely didn't mean to. We are finding out, though, that there is some differences in races and even genders that are going to require some specialized treatment. So it's actually going to become more and more what we're calling personalized medicine. So that we're actually finding out that there are some African Americans that respond differently to drugs than Caucasians. And there are some Asians that respond differently to drugs. So I think as time and time goes on, you're going to see more of the science taking over. And if it's not already there, I humbly apologize, but I think that you work for Pfizer, I work for Pfizer, and I think it's an incredibly wonderful company to work for. I came from an academic medical center before I went to Pfizer. My friends thought I was crazy. They said, you're going over to the dark side. But once I got over there, I found so many people willing to work so hard to do the right thing. And I think they really are.
I don't necessarily have a question. I have observations to make. I'm a Cyril Grousman, and I'm in my 85th year, and reasons known only to the gods, I'm not positive. And I've been an active person within the gay community for a number of years. One of the greatest things that's happened in the United States, a really outstanding thing, is the fact that we have the extension of life up into the hundreds now. Not so when I went into healthcare. And one of the things that, although it was looked upon arriving at 60 or 65, was you were a burden. It still exists. The whole notion of it being an aged person it was really a gift to me that I am so old. I didn't want to live to be 30 and I'm not, and I'm happy for every day and an opportunity to say that. And I thank the drug people and the medical care people, but what we don't realize over and above the HIV thing and over and above being gay is the fact that the attitude and behavior among providers and consumers of health is not healthy. The idea of the rejoicing in being aged, rejoicing in being able to provide people with a way of life. The film shows it beautifully. But what it doesn't have the opportunity to show is the poor, very isolated, aged people in this community. I am not happy to have to say over and over again that in the 51 districts of this city, and that's all there are, in each one of them, there is a large pocket of aged people, many of them minority, living way below the poverty level. I don't develop those figures. The government does. This current campaign in the city, for example, is ignoring the whole issue of aging. Ignoring it. Thank you.
And that would be my closing statement as well, is to really look at people as resources and not as a burden. And that's a little bit what we're hoping to do with this movie, is to share that, yes, it's virtual, it's not the same as doing it one-on-one in a room, which is obviously much more important. But for people who don't have that chance to be in the same room and who don't live in New York, but maybe, sit in Arkansas and don't know anybody else who's over 50 and HIV positive, we're trying to get these resources out in a virtual way. So that is the idea, and I think community is definitely one of the key issues here.
Thank you.
Thank you. I want to offer each panelist an opportunity to offer a closing thought or a question.
Mine is just going to be to compliment the filmmaker, because I think it's an awesome video. It makes you really stimulated.
The road ahead is split into two distinct pieces. One is treatment and maintenance. We're doing great. The other is prevention. Both medically and socially, we are doing terribly. I believe the last vaccine has been withdrawn from clinical trials, the last viable vaccine. Infection rates are increasing in some communities. So we're missing the boat. I mean, there's something just totally wrong with the prevention piece. I don't know the answers, but I know the questions. And Pfizer is doing great on the maintenance piece and the treatment piece. What's happening with the prevention piece?
I've talked to our president of vaccines, and there is a huge roadblock that he sees scientifically in addressing the HIV vaccine possibilities. So he seems to think that it's going to be a long way off. It's not coming around the corner like we had originally thought. And he talks way over my head. I know a little bit about science, but he talks way over my head and the reasons why he thinks that. But I think we're going to see probably prolonged treatment before we see a vaccine, and additional new treatments, but I'm still hopeful for a vaccine eventually.
Thank you. I think this concludes our panel. So thank you, everybody.